All right, let's talk the latest on the coronavirus. And a new federal mask mandate goes into effect tonight.
Issued by the CDC, it requires face coverings on all transportation services, and that includes planes, trains, buses, taxis, and ride shares. The mask has to cover your mouth and nose. The order also extends mask requirements to waiting areas like an airport gate or subway station. The CDC says anyone who doesn't wear a mask in these areas could be denied transportation.
Well, the frustrating struggle to get vaccinated continues as the availability of the vaccine kind of just trickles out. But there is hope that the Johnson & Johnson vaccine will get quick approval this week or maybe next, and that will help the situation. However, the new vaccine's efficacy numbers fall short of Pfizer and Moderna. John Shumway is looking into whether this should concern us, and it is a difference. I mean, we were talking about this. The numbers are a different thing, but still a good thing, I guess, to get this.
Right, absolutely, David. And we have to remember those numbers are in the initial phase, and it gets better with time. The numbers Johnson & Johnson put out are indeed lower than the others. Infectious disease specialist Dr. Matthew Moffa has no hesitation.
Take whatever vaccine is offered to you as soon as possible, because the quicker we get people vaccinated, that will help the general population.
As the vaccines become more abundant, you will have a choice by where you choose to get vaccinated.
I mean, how selective should the public be?
I would say when it's ready, give me whatever's currently available.
But Dr. Moffa adds none of the vaccines are an immediate green light to normal life.
All vaccines take time, so they're not going to work on day 1, day 2. Usually, it usually takes about 10 to 14 days before we start seeing that efficacy.
If you've had the vaccine and it's been a month since you had it, why would you have to continue the mitigation?
None of these vaccines are 100% effective. And we also don't know the key of how much asymptomatic transmission you could do after vaccination.
Yeah, I want to reemphasize that point because you've seen people are being vaccinated. That does not mean that you cannot still carry the virus and spread it to others, even though you've been vaccinated. There just hasn't been enough research yet, David, to rule out that possibility.
That's very interesting. You know, I would think that at least some people would want the Johnson & Johnson vaccine because so many people are reporting getting sick with the second shot of the other vaccines.
Right, and Johnson & Johnson is a single dose. Dr. Moffa says that little bout of illness you get with the second shot is actually a good thing. You may feel like crap, but it's a good thing. It is proof that your body is building up the antibodies you need to ward off the coronavirus.
Well, you certainly want it to work. So
Yes.
if that's what that means, that is good.
Exactly.
All right. Thank you, John. We appreciate it.